Stacy is describing what I consider probably a genetic predisposition to her panic attacks, and that's very, very common. Very often in patients, they can tell us who else in their family has panic attacks as well. Almost everyone has had a panic attack in their life, and that's that feeling of a wave coming over you, maybe your heart pounding, maybe feeling it at other parts of your body. That's very, very common. Not everyone has panic disorder. To have real panic disorder, you have to have frequent enough panic attacks, you have to have the fear of fear in between, and always the line in the sand is functioning. It's got to interfere with your functioning. Stacy described a good bit of impairment from her panic attacks, and probably also caused by what we call agoraphobia. She was avoiding situations. She talked about having difficulty going to movies, going out with her husband, even when she was cutting someone's hair in the chair, all of a sudden having to leave work. And that is very common, that people get scared in certain situations, they feel very uncomfortable, and then they escape or then start avoiding them. Medications are very helpful for panic disorder, and there are a number of kinds of medications that work well for panic disorder. For some people, with a trial and error, they find the right medication, they can stay on it and be helped for years. For some people, after a while, they do need to switch. Sometimes the easiest thing might be increasing the dose of the same medication, and then they can stay on that and it can still be effective. Sometimes they do need to switch medications or try cognitive behavior therapy. Cognitive behavioral therapy, or CBT, generally we try to teach people, one, that they don't need to be as scared of the feelings as they are, that they can be anxious and do it anyway, that nothing bad will really happen. We're really trying to decrease that fear of fear. We will teach them some techniques to help manage their anxiety, and also teach them how to go back in the situations to tolerate the anxiety and see that it's not as bad and nothing bad happens. Part of cognitive behavior therapy for panic disorder is bringing on the physical sensations of panic on purpose and learning that you can cope with it. It might not be comfortable, but they don't have to be as scary, and that they'll go away. So this is one way that we help prepare people for panic attacks, is by bringing on the symptoms on purpose and letting them see that they can cope with them. We have very effective treatments for panic disorder. Both medications and cognitive behavior therapy have been used, and in many people lead them to lead panic-free lives afterwards.